In the Doctor is In segment this morning, we are talking about Black maternal health. This week is Black Maternal Health Week. Health professionals every year at this time try to raise awareness of the racial disparities in maternal health, especially when it comes to Black women. Joining us now this morning, Dr. Thomasena Ellison. She is the Associate Director of Gynecology at Maimonides Health in Brooklyn. Great to have you with us this morning.
Good morning.
Such an important topic. When you hear that number, that Black women in this city are more than 12 times more likely to die from pregnancy-related complications than white women. As a medical professional, what does that do to you? What do you say to that when you hear that?
Needless to say, that's disheartening, right? Yesterday I was at Brooklyn Borough Hall celebrating Black Maternal Health Week, and I shared that 30 years ago when I was in labor, on the way to the hospital, I told my husband, I informed him that every woman who goes to have a baby doesn't come home safely. And now 30 years later, we're still in this situation where we have moms who are going to have babies who are not coming home and not coming home safely. And needless to say, having practice obstetrics and gynecology for more than 3 decades here in New York City, it's a little bit discouraging, to be honest with you. But the fight will go on. We will push on.
And we should point out, most of these pregnancy-related deaths are preventable.
Yes, they are. We're talking about preventable maternal deaths. That's what we're talking about. And that's even more so in our country, in our world, that we are still talking about this 3, 4, 5, 6 decades later.
It's not just a problem here in this city, it's a problem nationwide. The CDC says that pregnancy-related deaths among white women dropping, but that's not the case among Black women. So we hear about racism within the healthcare system, lower health insurance coverage, access to care. As a doctor, what do you see? Do you see all 3 of those
Yes,
factors?
absolutely, absolutely. And the structural racism is so buried deep into our world. I remember hearing it's incorporated into our DNA, that access to care, understanding what's going on, having a provider who can speak to your issues within the facility that you're being cared for and outside of the facility. What's going on at your home? Do you understand the importance of weight management, diet? Can you get the right foods to support your pregnancy? Can you get to your doctor or your midwife? Do you have access to a doula? Are there community programs that support you in your pregnancy? Such as you would have maximum care so that when you go to the hospital or at the birthing center, that you would have a good delivery, that you would come home safely. So these are the things that we're still pushing for. We're still pushing for programs that are impactful. And oftentimes those programs need to be designed by the mother, the woman, the birthing person, right? So a doctor can say, oh, I think you need this medically, but socially, what do you need to get to the point that you're optimizing your medical care?
If it's still a problem all these years later, decades later, what are we not doing that needs to be done, do you think? What's missing in all that, do you think?
I think one of the things that's missing is not having the patient at the table of discussion, right? And planning so that we can have programs that are impactful specifically for her and her family situation. As I say, structural racism, very deep with very deep roots. We need to dig those roots up. And that goes outside of healthcare in and of itself, right? Proper housing, right? Transportation issues, employment issues so that you can be properly insured, right? No woman should have to have the issue whether her insurance is active before she shows up to her care provider. So lots of steps, multifaceted. It cannot just be a narrow lane that we're walking down to improve healthcare.
Tell me a little bit more about what you folks are doing there at Maimonides that is sort of, trying to target this issue.
Well, Maimonides has the largest maternity care in New York City. Partly because the area that we're located in is an area that houses lots of Orthodox Jewish women who they're very reproductive and having lots of children. And for this reason, we are very focused on having the best outcomes because of that. So what we do, we have an extensive high-risk department, maternal fetal medicine in medical language, but in plain old English, it's just high-risk department, who takes care of the women who have the most severe issues prior to getting pregnant, which is really, really a big thing to do. So we're taking these women, discovering what issues they have, and addressing those issues hopefully at the time they're getting pregnant, and even more so before they get pregnant. So we know what we're dealing with and we can navigate and do better for them.
Dr. Thomasena Ellison from Maimonides Health, it is a pleasure to have you with us this morning.
Thank you. Thank you.
Such an important topic. Thank you.